Question about ERISA and the healthcare bill or healthcare effort. With 20 to 30% of the people in those plans, and if they're not in a single payer that's designed, can it really be healthcare for everyone? I mean, can you really call it that?
Yes. You know, we all understand that an ERISA exemption would be helpful to us. The state of Hawaii has gotten an exemption from ERISA. We would love to be the second state. But we will go in with our eyes wide open. We have to design a bill that understands that we may not get an exemption from ERISA.
Should hospitals, some of the smaller ones, be a little nervous about this effort? You talk about cost containment. Can Vermont continue to have as many hospitals as it has?
You know, what I say to the small hospitals is we aren't going to do anything that's going to make you more nervous than you should already be. And when I talk to them, they're plenty nervous. I mean, they have a system that doesn't make any sense. If I was running a hospital and every year the reimbursement rates changed and that really asked us to deliver health care in an environment where you can't control your own revenue flow, I'd be nervous, and many of them are. When I go talk to Porter, when I go talk to folks at Grace Cottage, it doesn't matter how big or small, frankly, Fletcher Allen, they have real concerns about the existing system, and we have to remember that. We want to work together with them to build a system that they can succeed in.
How about, to pick up on that, some of the higher paid docs, among the questions downstairs this morning, for the improvements in compensation and attracting more primary care physicians. What about those at the top of the income scale? Are we going to drive some of them out with this reform?
You know, I thought one of the interesting things about Dr. Shaw's report is this is not about paying providers less money. This is about finding waste and inefficiency that we're spending a ton of money on. And so, you know, frankly, we're not going to be going after the income that providers are making. What we're going to go after is the waste and the inefficiency, which is excessive in the healthcare system. You know, if you came in with our current system, let's just pretend we didn't have a healthcare system, and you laid out the one that we have now with various payment schemes and the way we go after money and 16 bills, 14 bills, 12 bills for every time you go as an insured individual to a provider, you know, you'd reject it out of hand. It wouldn't make any sense. It's a business plan that's destined for bankruptcy. So, you know, we've got some heavy lifting to do, and I think for us to pretend that everything is okay, and therefore we don't need to figure out a better way, is really, you know, as my good friend Howard Dean once said, it's la la land. We've got to make change.
Dr. Shaw said this morning that it might be possible for the state to go ahead and start, you know, with a uniform payment system as a stopgap before 2014. Is that what you're suggesting when you say that you're interested in pursuing a bill with cost containment?
Yes, we want to do everything that we can as soon as we can. And, you know, Dr. Shaw's done a great job. He might not have had to use high-speed internet in most of our state, and he might not have had to use cellular in a lot of our state. I mean, we have some challenges. Cell service and broadband is directly related to delivering on a more efficient healthcare system. And that's why that 2013 date is so important, and I'm working every single day to deliver on that promise. We've got to get it done to make this work.
But that's different from
medical schools around the country, and just among doctors around the country, there are a few, you know, maybe a minority of doctors, Deb Richters out there who believe in something like single pay or more progressive healthcare systems or whatever. They might be recruited to come to Vermont because Vermont's trying to do something different from the rest of the country. Is any effort underway to do that kind of thing, to put out the word that Vermont might be a place for those folks to come and thereby get some of the primary care and other other kinds of docs here?
You know, if we can actually do this, which I believe we can, I think it's going to pay lots of dividends. I think there will be providers who are working in a system in the other 49 states that is driving them into bankruptcy there that will say, wow, Vermont has a sensible system. I think there's going to be businesses that say, hey, the biggest challenge we have is rising healthcare costs. Vermont has it under control. Let's go there. So, you know, there are huge landmines ahead, but there are also tremendous opportunities we've got to harvest those opportunities.
Have you had your staff look behind the scenes at Dr. Shaw's numbers to have any sense of whether that $500 million savings is realistic?
We think it's real.
You've looked
Yes.
behind the curtain to,
Anya Rader has looked behind the iron curtain.
Is
And she sees green.
Is there anything that you don't buy in the report?
You know, as I pointed out, they did an extraordinary job. Obviously, it doesn't solve all of our problems. When you actually go and run and design a healthcare system that has not been designed, it's a pretty overwhelming undertaking. And so we have a lot of work to do. And that's why we put together the best healthcare team that we think any state has to help the legislature deliver on the opportunity.